I'll take you through our screens here in a quick tour. These are the data, the data bank that we have for the Hajj from day one of the Hajj until the end of the season. What we do here, we look at every single institute and every single pilgrims visiting our institutes, starting from the port of entry until they go back to the port of exit. So we can here track down beds, heat stroke units. We can track surgeries. We can track primary care, port of entries, the general check we do at the entry for certain population from certain countries, like for triaging. And we also can monitor our supplies, we can monitor our pharmacies, we can monitor our laboratory, blood banks, and everything. We can look at it from this room. We have more than 59 actually, as a matter of fact, 59 dashboard, major dashboard, and under each one we can drill down into the single institute. So you can imagine how difficult is this. To do all of that, we have to have a very strong HIS. The HIS that we have in the hospitals covers all hospitals, and we have health information system also for the primary care, and we do have health information system for the ambulances as well. And those all three systems are connected together, and we can see them all here. I will show you, we can track ambulance cars as well. We can know if the ambulance is full or empty, and if the patient is outbound or inbound, so we can see all of that. We can also look at our supply from the main store, from the company, down to our own stores, and to the sub-stores in the institute. So we can visualize all of that in this room. Let me start with you here. This is the executive screen. In this executive screen, we look here at the services we provide. Like, for example, we look at the visit per total healthcare system in the country. As I said in our interview earlier, we have like 140,000 services performed. Surgeries are there, labor and delivery. Some women, they come pregnant and they deliver here.
Yes. And
those who report to our primary care or hospitals with pregnancy-related illness or something else, and we record that she's pregnant, so we can follow them up in the hospitals or in the primary care. We can look at the admissions. We look at the heat-related illnesses. We can also check the transfer of patients through medical evacuation. We do have 24 evacuation have done in the last 12 days. We do also look at the inter-facility transfer. Yes. Between hospitals. These screens are more of the details. Here what we have, when I said 59 main screen, behind these screens, so we can flip between screens.
Absolutely.
These screens, the one that we are seeing right now, we can see the emergency outflow. We can look at the pharmacy as well, the surgeries, the hospital summaries as well, the outpatient, the bed management. Why we are looking at these, right? Why we have these fixed today? Because in the past, when during COVID, you would have seen the public health.
Absolutely.
But because of the heat now, we look at the emergency room, we look at the pharmacy, medication required, we look at the lab. So these are the screens which we are fixing for ourselves right now. But we can, if the IT guy with us here, he would have flipped the screens to show you what we have. In these screens, we can see these are the service zones.
Yes.
The red ones, it means that the flow here is heavy compared to the green ones. So as the color change, it tells you how busy this primary care. So what we do, these are primary cares mainly. So what we do, we ask those in the green primary care, some of them, they go to the field and attract the patient to their primary care to deflate the one in the red.
Absolutely.
So this is like a mechanical triaging, where we ask those guys, we tell them, guys, your primary care is not very full. You need to go outside, attract some of those who look exhausted, attract them to your place, and not to push them to the red ones. So we just to manage the flow.
Brilliant.
And I think you have seen the field team.
Unbelievable.
Yeah, they were distributing water, juices, and refreshing, and they are also checking patients who look exhausted, and they pull them into the institution, whether it's a primary care or hospital. And we can also look here at the inpatient, how it looks. We do have, these are the supplies. This is amazing. This is where our supply and supply chain. We can see it here from the stocks in the government or in the company that's supplying us, and we can track one hospital per se, for example, and we can see in that hospital what do we have inside it. Here we look at the primary care. Every primary care we can see, these are the closed one. These are the one in Muzdalifah and Arafat.
Yes.
They're already closed. So all the supplies in there now has been pulled out to the main stock and redistribute in the active primary care. So that's why whenever there is a yellow one like this one, so if it is active, by midnight there should be no yellow primary care.
Replenishment happens.
Yes, midnight and midday
here
actually.
We have the details of all the supplies, right?
Exactly,
Yeah.
exactly. And this is the very last screen that is open right now, which is how we look at the hospitals. For example, these are the Mina and Jamarat hospitals. We do have 4 hospitals for the Ministry of Health are there. We do have also National Guard and Civil Defense. But we are showing what we have now in the Ministry of Health. These 4 hospitals, actually, their capacity is 500 beds. We do have 500 inpatient beds. We do have ambulatory care also, 221. We do have in the general wards, the ICU number is 126. That's in Mina, and you can look at them by hospitals, like what we see here, Mina Al-Wadi, Mina Al-Shara Al-Jadid, Mina Emergency Hospital, Mina Al-Jasr Hospital. And if you click on any of them, this is an interactive screen. You just press the button, it gives you the details inside it.
Extremely impressive. I'm also very happy with the vacant number of beds, meaning that...
Exactly. If we just look at the bed occupancy here, Min Al-Wadi, 80% only. Min Al-Jasr is 63. Min Al-Tawari, which is Mina Emergency Hospital, is 52%, and Min Al-Jasr is only 50%.
Very impressive.
That is our target, to keep the hospitals under the... And also, what we do, for those patients whom we think that will stay more than 48 hours, we send them to Mecca hospitals.
Okay.
We also monitor Mecca hospitals in here.
Absolutely. Very impressive, doctor. Congratulations. This is extremely... I don't think I've seen this in any other country, and this is part of my specialty, and I haven't seen anything like this anywhere in the world. Congratulations, clearly.
Thank you very much.
Thank you.
Thank you.